IUD insertion step by step. Hi there. IUD insertions are not fun for the patients. It's quite a painful procedure. My goal is to make it as smooth as possible for the patient. Here are some of my tips to tell the patient first. It's not going to be fun, but I will be here with you. When the IUD goes in, you will experience a deep-seated intense cramping pain, but it will be very quick. So bear with me and we will get through this together. Remember, you will be free for the next 3, 5, or 10 years. Now, how to prepare for the IUD insertion. Get the right IUD. Check patient's name, IUD expiration, lot number. Make sure patient took an Advil or Tylenol before the procedure. She should be on her period or just ending it. We have a recent PAP and STD testing on file. Should be from within the year. Pregnancy test should be negative. Here is what we need. IUD, speculum, ring forceps, tenaculum, long scissor, Surgilube, betadine in a clean cup scoopets, sterile gloves flexible dilator only if we need. My technique. In an effort to make the process as painless as possible, I do not perform IUDs in the traditional way. So my 2 tricks are, do not sound unless in doubt. Hold the cervix with a ring forceps instead of tenaculum. With a prior ultrasound, we make sure that the uterine cavity has no abnormalities. Now, the nitty-gritty. Perform a timeout. Insert the speculum. Clean the cervix 3 times with betadine. Take off your unsterile gloves and open the sterile gloves. Use the open package of the gloves as a sterile field. If the cervix has enough thickness, then use a ring forceps to grab the anterior lip of the cervix. Get the IUD ready in your dominant hand. Estimate the position of the guard in case of Mirena or Kylena, etc. Gently give traction to the cervix and straighten the canal. In one swift stroke, insert the IUD to negotiate the cervical canal with a steady but not excessive force. Perform the insertion maneuver accordingly and remove the inserter. Cut the strings. Get the speculum out gently and keep talking to the patient. Offer her water and comfort. Have her come back for an ultrasound in 6 weeks to confirm location. You can also do ultrasound on the same day if in doubt. Caveats and concerns. You may feel that you can perforate the uterus. If you are aggressive and insert with undue force, then you can perforate. Insert with firm and deliberate technique, and with experience, you will learn to use the IUD inserter as a sound and then do the following maneuvers. It's just practice. Remember, patient feels pain every time we go through the cervix. Hence, I devised this way to insert IUDs. Here is an actual video.
Today the IUD insertion video, and our patient today is Lucy. Do you have all the instruments?
Correct.
Yeah.
Yes. So we have long scissors, ring forceps, metal speculum, and sterile gloves, which is very important, betadine, and scopettes for today.
Yes, we don't have the tenaculum because I usually don't like to use the tenaculum, but we can keep it as standby if we need to. And I normally don't use sounds for my IUDs, and I'll show you why. Alright, so Lucy, so do you know which IUD you're getting?
Yes,
Which one?
the Kylena.
Okay, so you know Kylena is a hormonal IUD. It lasts 3 years, and you may get some irregular spotting bleeding for first few months, which is pretty normal. And it does have a failure rate of about 3%, which is normal. If you miss your period or if you feel weird, then do a pregnancy test, come back to us, and we'll see you. As far as the pain, did you take some Motrin?
I did.
Good. So there is a weird deep-seated pain as we go in, but it's usually very quick. I'm pretty quick in doing this. Either it goes in one shot or it doesn't.
Okay.
Good?
Yes.
Okay.
Miss Lucy, could you confirm your first name, last name, and date of birth for me, please?
Lucy Perel, 2/27/1984.
And could you, do you have any allergies to any medications or food?
No.
And do you know which procedure she's doing today?
Yes, the IUD.
And which IUD once again?
Kylena.
Okay, perfect.
So what we did was just, what's it called?
A timeout?
Yes, excellent. All right, so here you go, Lucy. just gonna lift your butt. We're getting ready here. So we're just getting ready, okay? Alright, so I'm taking the speculum here. May I have gel, please?
Can I go on that?
We may need a smaller
Tamia, can I go
speculum.
on this?
Sorry, we'll come this way. Okay. So you take a speculum. And then we're just going to go in gently oblique fashion. And this speculum may be too big for the mannequin.
Tamia, can
Actually, it's not. It's perfect. Alright, so we go in obliquely posterior surface, open it, lock it in. Good. Now we use the Betadine. The cup has fresh Betadine every time. And we discard it at the end of the procedure. 3 scoopets is what we always use. So, sorry Lucy, we're just getting ready. This is all prep. 1, 2, and 3. Okay, so I'm going to discard it. So now what I do is while my assistant gets ready with other things, I'm just going to make a sterile field here with sterile gloves. And we'll use the cover of the sterile gloves as a sterile field. So I'm not touching the inside, I'm just gonna put the gloves on. Okay, just fix it here. Okay, so can I have the reinforcer please? Alright, so the way she's handing me is from the back and I'm just going to use a ring forceps. The reason I use a ring forceps is it causes much less pain and less bleeding from the IUD side.
Just to pull.
Yeah, and I don't usually sound my IUDs. I know that's kind of strange for people. So what I'm going to do is, yes, you could put the model there. Yeah. I just want to show you how I grab it. I'll just grab the top and I don't click it completely because again to minimize the pain, I'll hold it right here.
I'm sorry.
It's okay. And then you want to hand me the IUD. So you're opening the box and you've already confirmed the lot number and expiration, right?
Correct.
So we're not touching the tip. This is Kylina. So pretend that her urocervical length is about 8 centimeters. So this is how we're going to go and then I'll show you outside in the model. Keep the cervix, anterior lip of the cervix held by the ring forceps and then we're going to insert it here and usually it should go in one shot. And now I'm just going to move it out here so you can see. Can you hold that for me? Yeah. Alright, so see I haven't sounded it but I'm going to go to the tip and this was my estimation where I kept the black ring around it and I'm going to keep holding it like that. We go to the fundus, pull back, keep it stable, pull back the black knob on this and then push the thing to the fundus and then put everything out here. And because in the model the IUD is not going to stay that way, so I guess it's just going to come out, but we pull the thing out and then we cut the string about 2 centimeters. Can I have the scissor please? Again, she's handing me from the back and I'm not cutting the string because I want to use a model for later, but this is how you just cut the string. And then I'm going to put all my instruments here. I'm going to take this out. Alright Lucy, I'm sorry, it's all done, okay? I'm sorry for the pain, just done. That's it. We are done. Alright, so Lucy, you need to come back for an ultrasound in 1 month to make sure the IUD is in the right spot. You may get some cramping pain after this for next few days and some spotting and that's completely normal, okay? You can take Motrin or Tylenol every 6 to 8 hours if you need. Or just have a glass of wine because that helps relax the uterus and it helps your pain.
You really tell them that?
I do, yeah. Alright, so you're all good and take care. Bye.
Thank
Any
you.
other questions?
No.
Okay, perfect.